When should you start checking your hormones? So, interestingly enough, there are no national guidelines telling us recommending to start taking hormones at any particular time. There's actually no recommendations on how to test for hormones. There's no recommendations on even doing hormone replacement therapy, and how to measure hormones after starting hormone replacement therapy. So, that's a little concerning for me. But I will tell you what I just do in clinical practice. So a lot of people ask me, they're in their 20s, should they just screen their hormone checks like we would screen like a thyroid function? And I would say probably not. Because those hormones are going to fluctuate so much throughout the month, before ovulation, after ovulation, depending on which phase that you're in, and you can't really interpret those labs and or really come up with a care plan to address them unless you really know where they're at in their cycle. And then B, the testing is not that great, right? So if we're just testing in the blood, you're really not going to get what the tissue level, so at the cell receptor, is going to actually be. What you're going to get is just what's in the bloodstream that's not always utilized, hormones that can be utilized in the body. So I don't recommend just random screening of hormones unless, of course, you're symptomatic. So if you're in your 20s, early 30s, if you're having really heavy periods, really cramping periods, if you're having a lot of like endometriosis type symptoms, if you're having like fibroids, breast cysts, or even severe mood symptoms with your periods like PMS or PMDD, then I would say yes, you need to check your periods, but know when to check and how to check. I do start screening most of my clients, whether or not they're symptomatic, in their mid-30s, because that's when we're going to start seeing the progesterone levels go down and we start seeing estrogen dominance start setting in. And estrogen dominance is what leads to all those symptoms, right? So the mood swings, the insomnia, the hair changes, the skin changes, and then we start to see our also fertility starting to go down as well. So I will start screening about once every year to every other year in their mid-30s. And then, of course, I'm screening most women before, during, hormone replacement therapy. So sometimes on occasion I will start hormone replacement therapy without checking a baseline labs. Most of the time though, that's a typical practice for me. I'm going to check the level, but on occasion some women are just so desperate to get started. I'm confident that I know what's going on. I will start them on an empiric dose of hormones, but I always measure their hormones after starting therapy. So I hope that answers your questions on when to get tested, who should get tested, and how should you be tested for your hormones.